Hi everyone. It's an interesting week. I am in the mother of all flare-ups, and yeah, I think you might have noticed if you've been watching my videos how I can't sit for even 30 minutes anymore. I just can't sit. The SI joints, like the back of your bones, where your buttock is, that bone, that area, that's where the inflammation is the worst, but it's everywhere. I'll get to that. It's been everywhere. Even my rib cage has been aching and sore, like shoulders, elbows. I couldn't do my exercise, not only because of my shoulders, the lift, pull down, back, whatever, back. What I don't actually know what it's called. I'll show you a picture again. Because of my elbows, not only because my shoulders cry, but my elbows too. It's scary. So anyway, let me start with the nice thing. This week has been one of those positives in terms of validation for what I'm doing, my work. My work is to educate my children. My work is to also be a therapist, and so I am working. My pay is actually quite fine, really. I am actually getting paid the same as a sibling of mine who's a teacher's assistant at a school. Plus, I get extra perks because my husband and I have a joint account, so I can buy anything else with his money besides my own salary that I get. But anyway, in terms of family and relatives, there's been zero support. Like, nobody has supported us, has asked how the kids are doing. I did tell one sibling, I did try. Brain fog is real. I am confusing the children's names even more than I usually do. I mean, we all know parents who do confuse their children's names. My mother only had two, but she would confuse mine and Lebu's name. So that's my sister Lebu. So it's normal. But I have not been doing it this much until now. And I've been writing things. I got an email from Snap Academy. Now, I'd looked at Snap Academy. It's a special needs adaptive program, but I didn't like the fact that they have a uniform, and the uniform isn't like us. The girls would wear pants, and I don't want my children wearing pants. My daughter's wearing pants. So we are always looking at schools where their children can wear whatever they want, or the uniform is adaptive. There was a place I'd contacted where the woman said, no, my girl can wear a navy skirt and navy leggings, but then she never got back to me when I said, all right, can we meet? So yeah. Oh my word, see, brain fog. I forgot where I was going with this. But yes, brain fog is part of AS, ankylosing spondylitis, and many other things like menopause, which I've been dealing with for over a year now. Like real menopause, not perimenopause, but real menopause. I'm now 44 years old. It's been over a year of being on HRTs because the symptoms were way too hectic. But I don't think it's helped my brain. So I've been really confusing the children's names. I've been sending weird emails to places I don't want my children to go to. And I know because I suddenly got a reply from someone, and she was saying, here is the school fee structure. Thank you for getting in touch with us. And I was thinking, who are you? I mean, when? So I'd sent a message, guys, I don't remember sending any email at all. Yes, I take tablets that help with nerve pain, and they do have the extra impact of making you sleepy so that you can try to sleep through the pain. But I really don't remember emailing them. I don't even remember looking for the email. Like, this is bad brain fog. This is like brain death. And I'd written nonsense, absolute nonsense. It wasn't even, you can tell when someone is a second language speaker and their spelling is wrong, or the pronunciation, or they spell the way they pronounce. So you might say, they will spell, I live in wherever they live, but it's Leave, because the black accent is, I live in South Africa. So live as opposed to live. But this was worse than mispronunciation and misspelling. I just wrote nonsense like, I would like to vent my children. What? I really don't know why they even responded. It was like I was drunk. It was bad. It was really bad. my children, I've got 3 and 4, and it wasn't well. But she responded. But I'm not sending my children to Snap Academy. Plus, the biggest reason is it's too far. So let me go back to the validation part. Then we'll come back to the too far part. I took my daughter Amarissa to a new dentist this week. It was new. It's Northumberland Dental Clinic in Parklands. We went there. You had to put on booties. It's very different to any other clinic I've gone to. So we mentioned, she asked about the education, and she asked my daughter if she's missing school. So she told her, we're homeschooled. So that brought up I could never do what you're doing. Oh my word, you're amazing. And when people ask how many children I have, I tell them I've got two too many. And then I ask, okay, so how many do you have? And she tells them, I've got 2. And she said she figures her children would actually love if she had homeschooled them. They would have loved to be with her, but she would not do it. It's too much. It's too much hard work. It's too much 24/7 work as opposed to being a dentist. And I found that validating. Believe me, I don't think it's easy being a dentist at all. No profession. I don't view any profession as less than being a homeschool teacher. But I will say that being a special needs homeschool teacher is hell. It is hard, especially if you don't have any support at all. No therapists, nothing. It's just you doing all the research. You pay for all these professional therapists. It's a lot because you're doing all of it. The homework and the actual research and shoulder girdle exercises. I'd never heard of it till now. And that is actually what they call the core exercises, which we've been doing anyway. So yeah, it was nice that she said, yeah, no way. It's too much. So that was nice. It was nice to acknowledge that I am actually working. That was what I enjoyed. And I mentioned that my son, who's going next week for his cleaning, it was just a check-up and clean. He's autistic, so she's like, uh-oh, does he need to be sedated? So I told her, no, not him. He's okay. He's a bit touch sensitive, but he's okay. But I've got a 4-year-old who I know would need sedating. So she said, she's fine. She's dealt with autistics like that for years now. Some have actually been going to her for 15 years, and there are now adults who still go to her and still get sedated, sometimes even for just a cleaning. So she said the medical aid companies don't fight. I hope mine will be as easygoing, and they'll allow them to go to theatre, be put to sleep so that they can be worked on and cleaned. So I thought, phew, I found someone who has done it more than with one patient, gets it. So I'm glad about that, especially when her permanent teeth all come in. She's got 2 already. So I'm happy about that. On to the other problem. My body has been suffering a lot. So I went to the rheumatologist. I haven't taken any pain medicine yet. I just took my esomeprazole. Whatever it is, it's a PPI inhibitor. It's not omeprazole, it's the other brand. It's higher than omeprazole. But yes, to protect my stomach, because my pulmonologist suspected that maybe I've got reflux. So that's what I'm treating at the moment. It's been bad. The pain has been that bad that it's back to shouting nightmares. I've struggled to sleep until 1 a.m. Then I slept. 2 a.m. I was screaming in my sleep until my husband woke me. And in my sleep, it was like I was screaming, wake me up, wake me up. This is a terrible nightmare. I can't wake up. I can't wake up. And it always coincides with an increase in pain. Same, it happens also after surgery. That pain, that's when I have the nightmares. So yeah, I know it's linked. And so it's been that bad that I'm having nightmares when I do fall asleep, which then means I'm having even more limited sleep. And so today was my normal appointment. I start driving. If those who know Bloberg area, picture me driving from Bayside Mall going down to Kuberg Road, but I turn onto Potsdam through Danune and then out to Durbanville. I'm driving. I'm at the last robot before Kuberg, and the traffic light turns red. So I read a message that had just come in. And it's the doctor's office saying, oh, Dr. XYZ is running 40 minutes behind. I'm like, okay, let me turn back. So I turned back and came back home. I rested a bit, but I've got children, so I didn't. By the time I actually rested, it was 13 minutes, whereas I had 30 minutes of rest when I got home. But I did have to, give my children their iPads for doing Khan Academy school. I did discuss with my teenagers what to do with them. I talked with my little girl. It was her quiet time, but she went to the toilet. She asked for peanuts and raisins. So I mothered. And then I finally rested for 13 minutes. And then, yes, I went back, and it turned out she was actually an hour behind. So I had like a 40-minute drive to the place. And then an extra until o'clock. I got there at like 2:43, and I had to wait until past an hour. I think it was probably an hour, 10 minutes. The show was really running behind. So now I'd driven, and then I waited. So the rheumatologist comes in. Hi, how are you? So I tell her, I'm surviving. That's my answer, because I'm not fine. I am not fine, but I don't want to say I'm sick or I'm terrible, because I'm generally always terrible, but this is worse. So I just said, I'm surviving. So she laughs, and she says, okay, come in. I think they do that, now that I think about it, so that they can judge you walking. That's part of their medicine. I mean, walking in the little room doesn't really show them how you're walking. So so I get up, and then I take a step. Oh my word, my leg wanted to just give in. And she's like, oh my word, oh no, what's wrong? How long did this, what happened, and how long has this been going on, and when did this start? This is terrible. It was, it was sweet. It was good, but the more she expressed heartache, distress, sorrow, the closer I came to wanting to cry. And I don't want to cry, because I know that if I had actually begun crying, I wouldn't have stopped. It happened about 2 years ago, and I was with my orthodontist. What's that thing? The specialist who's not a dentist. They do crowns. Endodontist, yes. And she had just told me she'll do my 6,000 rand something for free. And I just lay there. I was in pain from surgery, and I was just crying the whole appointment, because I was so grateful and thankful and just overwhelmed with the suffering I was in. So it just cried the 30 minutes plus. So I don't want to cry, because it's overwhelming. When I really think of my reality, it's overwhelming. I've looked again for places to send my children. There's an occupational therapist I mentioned before on here, who I said to her, can we come? I just can't make Tuesday afternoons, because I'm taking my daughter to go and do her biology practicals far away in another town. And then she writes back with, can you come on Tuesday afternoon? And I'm thinking, but that's what I just told you I can't do. What's that about? So I answered and said, well, I can't do Tuesday. Any other day? No reply for months. So I thought, let me just try again. And the process was different, not the norm. It was like shortcut, which doesn't make sense to me, because I need to have my children's therapy all documented for all the other professionals. We see they need to know what was seen during the assessments. I need to know what was seen during the assessments. I need to know what was assessed. I need to know that thorough assessment is being done, not just being a fly-by-night type person. But she doesn't do assessments, and she, unlike other occupational therapists who have gone to on my own first, discuss birth history, discuss the concerns I have on my own with the therapist, she wants me to take the child with me. Now I've got 3 children, so I'm going to take 3 children once a day, once per session, like on different days. And I was thinking, but that's not fair to the child. I would not be comfortable talking about my child's challenges with her present. It's not fair to them, for their mental health. So that was already dodgy. But she's the only one in this area who was willing. So my daughter went, my 4-year-old, and I was so excited. So excited. We drive there, I don't see any sign, nothing that has the occupational therapist's name. So we park in a shopping center. My daughter is so excited, she's already unbuckled her car seat, she's walked, she's getting out the car. And I text the lady to say, hey, we're here in the whatever parking lot. I don't see any sign, number, anything. Can you tell me where you are? And then she phones to say, oh, I'm so sorry. I had texted my patients to tell them that I can't do therapy today. I'm not well. Oh, I see it's not come through. And I thought, really? if you know I've got an appointment with you, surely you will check that I know that you're not coming, that you're not going to see me. It just, yeah. But we all were a bit not sure that she's telling the truth even. So that is how that person who was already dodgy last time has ended up. So it's back to me, which is fine because I have paid for professional occupational therapy programs. But yeah, so the rheumatologist, she would go in, she tested my shoulder movement and she stopped because she didn't want to cause me pain. I wasn't complaining, but there was like resistance. My shoulder wouldn't move as far as it should, so she stopped. Same with my leg, when she moved it like this way, like, you know, this is my leg, right? She moved it, she bent it, and then to move it this way, there was resistance, and she was like, oh my word, no, you are too stiff. This is terrible. She didn't even do the back bend one. She was just, no, this is wrong. So she gave me an intramuscular injection, with cortisone, which she hadn't done before. And she did say, I knew, I'd seen my blood test results. So you do your blood tests 2 days before you go see her. It's for your inflammatory markers, CRP. It's for your liver markers, ALT and AST, and my kidney function. My kidney function is still stable at mild decrease, and my liver numbers have gone up quite a bit, but not there yet danger zone, but they have gone up. One has been dramatically up from like 8 and 10 to 22. The ALT was 17 rand. It was always like 17. It's gone to 24. And the highest max that is okay is 36. So 22, 24 compared to 36. No alarm bells yet. But for me, I'm going to be watching the trend. My inflammatory markers had gone up to the highest. They've never been this high. Not that when we've tested, rather, over the years. Since 2011, when I've tested different places, Ampath and PathCare pathologists, it's been 6. When I was sick with that virus, it was 10.1, but otherwise it's been 6, 5.5, and it was now 14.4. The maximum is 5. After that, it's danger. So, yeah, I was at 14.4, and I thought, phew, even my blood is saying this girl is sick. She is not doing well at all. So she looked at my test results. She was not happy with that. She showed me my eye from last year, and she was saying, this probably is the one. They put both the SI joints, look at how inflamed they were, and this is probably the worst one. So we've doubled all my medication, and we've added, we've doubled all my medication. Well, we've doubled everything, but my anti-inflammatory was a 60 milligram dose. She's told me to double that to 120 milligrams for 7 days. And then after that, I will go from the 60 milligrams to 90 milligrams. So that was the plan, right? And then after doubling everything, I must then tell her in 7 days how I am. I don't know what the plan will be if I'm worse or at the same level in 7 days. I really don't know. My fingers are sore. Everything is just, it's not great. And so that's where we are at the moment. We've doubled everything. We've increased one. So I was already having 1 night time, 6 of 1 and 8. So it's like about 13 tablets a day that she knew I was on. So I'm going to double most of those. It's going to be crazy. But if it can bring down the pain and suffering, I'll be happy. I miss exercising. I really do miss just exercising and walking freely. I really do. I hate teaching. And there was another discussion we had. She was like, you can't teach anymore. So she really tried to figure out how we can get help for our children. And she agrees. She knows that there's nothing in our area. No good government school for special needs in our area. She was saying, given how many people have special needs, children should have expected that the government would have built more special needs schools, because it's just not, we are underserved. She knows a good school close to her. We the teacher, a friend of hers was a teacher there, and she knows how it is, and she went to a concert that the children were holding. So that school, interestingly, is a school I know of, because a baby I held, now he's a boy, he's 9 years old, he actually goes there, and he's been doing well. Yeah, he was adopted by a lady. It was sweet, guys. It's another, okay, I'll tell you the story. I volunteered, I think I might have mentioned it before, but I volunteered at his place when my husband and I and the children went to one of his work functions where they were going to bond overnight. I think it was one night in a place called Swellendam. So I thought, let me go and visit a children's shelter. We were still waiting to adopt. We'd begun the process. So I thought, let me go visit a baby home and go volunteer there for the afternoon. So I went, and there's a little baby boy who was really, they said, the people who work there, they said he struggles a lot. He cries a lot. He's got stomach cramps. And I just held him. It was maybe 2 months old, and I just prayed for him that he'll find a kind of parent who will understand the struggles, the lack of sleep, who will love him. I just held him and I prayed for him. And they were saying they're so shocked because he doesn't keep quiet. And yet he was calm. A few months later, a lady I'd contacted, single lady, who I'd been friends with on Facebook, and we'd met via an adoption group. She tells me, guess what? I've got the call. I'm going to get my baby. And she sends the picture. And it was him. It was the little sweet angel. I told her, I'm so happy. And don't be jealous, but I held your baby already. Oh, my word. God bless you. So, we've been watching each other on Instagram, and he's grown and is well. He had problems. They said that they believed that in utero, before he was born, they believe he had a stroke. Something, whatever happened with the mother, but yeah, he had a stroke, biological mother, and he had some problems. And then eventually, after some years, after I'd been sharing my son's autism journey, she then said he's also been diagnosed autistic, but he's verbal, and he's been going to that school that the rheumatologist mentioned, and he's been thriving, and he's confident. I don't want my children to be replicas of other children, but I do know that they really take their work seriously. That's my point. So yeah, the rheumatologist was trying to figure out where we can live. She was even suggesting suburbs where we can live, where there is a big yard. And she was like, yeah, but it's not going to be very quiet because there are houses everywhere. Yeah, so it was that kind of appointment where she not only took care of the medical needs, but she really worried about the special needs and how it's too much for me to teach. And in the second and last part, in the other validation, she was saying, yeah, special needs parenting is hectic, teaching is too much for you. And then she asked which school my teenagers went to, because she knows that we're waiting for their results today, their final results. I told her they did well with their first part of their AS levels. We're just waiting for the last 2 subjects, and then please, we'll be done. If they don't do well, if they fail, then we'll redo in October. But I don't want to. They don't want to. And that's in a few hours' time today. Okay, many hours' time today that we will get the results. So I told her, no, I homeschooled to them too. And she's like, what? Oh my word, well done. I could never do that. And you used Cambridge. Oh my word. She was just so validating. It was lovely. I love and accept all encouragement. I really do. It's been a very lonely journey in terms of love and support from the people who you expect love and support from. So I'm happy that she thought it was such a big deal. So she's holding thumbs for them. I will get back to her next week, and hopefully I'll tell her that we've got this all under control. I asked her, what are we going to do about the Cosmetics? Sorry. Because the medical aid only approved to pay their 2,000 Rand of the 8,000 Rand until October. So she said, she's already begun the application process to get more approved from October on. We will watch, and we are both hoping that Cosmetics will fix me, because this is not good enough. I'm not good at all. So yeah, watch the space. I'm hoping, we're all praying, and we're hoping that this increase in medication will help. Signing off. See you later.